got an email from a member of the American College of Obstetricians and Gynecologists against this bill. And when we have some time on the mic coming up here, I'd like to share that into the record, and I'll also distribute it to our colleagues here. We cannot advance bills that affect healthcare providers when we don't have any input from those healthcare providers in the policy that we're crafting. I mean, say what you will about abortion, about the morality of that, about what is really a miscarriage. Thank you. I think that what's important is that we stick to the matter of the bill, which is that we are putting new requirements and new rules, new law affecting physicians into the abortion statute, section 28325, that affect physicians who don't perform abortions, that they were not consulted in the crafting of this legislation, that they do not want this legislation, and that now, just a process note, the bill has been voted out of committee. We are debating it on the floor. There was an amendment that was worked on over the weekend, AM 1924, to try to improve the bill. I could say slap something together to improve the bill, but that would be disrespectful to the people who worked on the amendment. But then it does feel slapped together when then I hear from doctors and nurses and their representatives in the healthcare lobby that they weren't consulted on the amendment. And then I hear from other leaders in the body that I don't need to name, I guess, that they didn't even know the doctors didn't like it, that they didn't know they were consulted. And so now we're kind of like scrambling to try to fix a bad bill when, honestly, colleagues, we need to move on. The truth is that, and I told the speaker, he said, do you think we'll be able to get to an amendment? No, because not until I see an amendment that the doctors can live with. We do way too much legislating in this body that affects Nebraskans that we know nothing about, that is none of our business, that none of us have anything to do with. Whether we're talking about requirements that we're giving to teachers, whether we're talking about requirements that we're giving to doctors and physicians. There are many cases, colleagues, where we don't know best, and I've done it too, we come into the legislature with what we think is a good idea. Maybe it's something you float out there to your constituents and they affirm that it's a good idea. It is a good idea to make sure that patients who are seeking reproductive health care, whether they want to be pregnant, whether they don't want to be pregnant, whether they're ending a pregnancy, whether the pregnancy is ending itself, this is a fraught time for any woman. And if they are experiencing abuse, trafficking, whatever, of course they need the care and support to get through that. Nothing about LB669 or AM 1924 changes that. And nothing in this bill is going to, change the standard of care that doctors are providing. What it's going to do is give them a chore. What it's going to do is continue to set the example in this body that we throw together legislation, that we cram it through and make it work no matter what. Frankly, because of the introducer, because it's a Republican bill, because it touches the abortion statute, and so we all believe we've got to make it work. It's been a great disappointment to me to see the abandonment of focus on good legislation. And this could be good. It could be good if we did not have the distraction of the procedural, calling the question, calling the House, roll call vote, reverse order, because now what we're engaged with is floor management instead of trying to fix this bill. The people in the lobby who represent doctors and nurses would like some time to come together and find an amendment that works. If I were the speaker, I would take that seriously and I would pass over this, knowing that it's going to go 4 hours, or I would round up my piggies, my little corral of people here, and I would say, stop calling the question. Let them tire themselves out. Let them make their little points. Let them say their stories, because we're working on an amendment. because we want to make sure that if we pass something, it's something that doctors and nurses like.
That's your time, Senator.
Thank you, Mr. President. Chair Bosin, Senator Storer, if you guys would like to have the support of the healthcare providers, Speaker Arch, if you want the support of the NMA on an amendment for this bill, they are reaching out to you in good faith to work together. I hope that you take that opportunity. It should be alarming to all of us with sharing the goal of protecting women from coercion, that there is nothing in the bill that clarifies that the person doing the trafficking, the person responsible for the abuse, isn't in that hospital room with this woman at the time of this exam. There isn't anything in the bill that specifies where that exam is taking place. Could this exam be if someone goes in for an MRI? Could it be if they're seeing a cardiologist? Could it be if they're already in there for a scheduled visit and they find out they're pregnant at that visit? That's not infrequent. There have been many bills in this legislature that passed with unintended consequences, and then we had to come back later and fix them. That's something that typically a chairperson like Senator Bosin would catch before it comes out of committee, or would be willing to work in good faith with opponents to remove the opposition. We started on Friday working in good faith with proponents of the bill, as one of the opposition leaders myself. We started Friday working in good faith, talking to the speaker, talking to the introducer, trusting that they were going to bring an amendment that addressed the problems of the opposition. All of that trust, Senator Arch, has been blown up by your crew continually calling the question and refusing to allow full and fair debate to occur. I know that you can't control what everybody does. I know that on the Republican side you have your own infighting and your own drama. But I would like to see one leader of this legislature step into their power, step up and say, we are taking LB669 seriously. We want the introducer to have the chance to bring a worthwhile amendment, and in order for that to happen, we have to preserve trust with the opposition. At our Legislative Council meeting in November last year, when all the new freshmen came in for the first time and we got to know each other, Speaker Arch led a whole workshop on trust, on how we cannot be productive together as a body. As the only one-house legislature in the country, as the only nonpartisan legislature in the country, and as the smallest legislature in the country, with only us 49 members, there's a lot of advantages to that, but a disadvantage is if we lose trust, there's really nowhere else to go. If you burn a bridge in here, you don't really have that many bridges left. That's a big difference of the way we work here in Nebraska. We have to preserve that trust so that we can be productive. And by standing up, calling the question, preventing full and fair debate, it's only increasing the tension of the well-meaning, good faith actors, including Senator Storer, Speaker Arch, members in opposition, and members of the lobby who are representing healthcare providers who want to make sure that if we pass LB669, which seems to be a possibility still at this point, that it's not having these unintended consequences that slip through the fingers of Chair Bosin. And that's something Chair Bosin should want too. Let's get this right. And we can do that if we maintain trust, but we will lose trust and you will not be successful
That's your time,
if you continue
Senator.
to bully people off the queue. Thank you.
Thank you, Senator Hunt.